Hi everyone, today I'm reviewing markings from a recent left incomplete cleft lip repair. Remember, this is one of the more common surgeries that I perform. I mark the alar bases because even in the incomplete cases, you'll see that the alar base is located inferior and lateral on the cleft side. I mark the columellar base and the oral commissures. The oral commissures help for positioning of Nordhoff's point. Here's the red line being marked to separate the wet and dry vermilion. It is essential that these are properly aligned to avoid crusting postoperatively. Now, I spent a lot of time marking the white roll on both the medial and lateral lip elements, marking the vermilion cutaneous junction and the superior portion of the white roll, because I feel that this helps to best determine Cupid's bow peak and trough on the medial lip and Nordhoff's point on the lateral lip. You just follow the cascade of the dots to best determine where the trough is and then the lateral Cupid's bow peak. And you'll see in this case, I'm measuring and remeasuring and checking and changing some measurements. Sometimes it's more challenging to find these locations than in other patients. And then the angle of Cupid's bow peak and trough is determined by the patient's anatomy. In a bilateral, you can determine this yourself and make the angle between Cupid's bow peak and trough more acute. So from the medial Cupid's bow peak, I gently draw a rotation flap. Don't extend this beyond the opposite philtral column, and then extend the C-flap intranasally. This will be used for the nostril sill or to lengthen the columella. Here is mucosal flap being drawn, and now Nordhoff's point being determined. Usually it's at the thickest point of the vermilion. Also measure the distance from the oral commissure. Here I'm using calipers to measure the vertical height as compared to the opposite side. So I mark Nordhoff's point, and I'm now extending down from Nordhoff's point for the mucosal flap, which is drawn with a convexity because it's thicker on the vermilion is thicker on the cleft side. Here's the advancement flap being drawn. Don't extend this beyond the alar base. Now I'm measuring the length of the advancement flap, comparing that to the opposite philtral column, and notice that it's longer. So I'm drawing a triangular wedge excision to shorten the lip on the cleft side. Remember, it's very easy to make a lip too long in an incomplete cleft lip. So here you want to include a vertical wedge excision if you need to. And then if you have a frenulum to the upper lip, you want to draw a Z-plasty to release this. So here are all the final markings. If you have any questions about cleft lip repairs, please leave them in the comments below, and stay tuned for his on-table results tomorrow.